I use that analogy specifically, and I think with some of the comments the mayor of Las Vegas made are very concerning. We don't have that approach here, and I don't expect to have that approach. But what we want is to be able to see a decrease. What we have done with leveling off our curve is we've spread it out somewhat. So it's not surprising to me that we're still seeing cases and we're still seeing transmission. So now is our time to really get on top of that, for people to be acutely aware if they're not feeling well and to get tested, to make sure that you're staying away from others when you're doing that. This is our time to try and bend that down, not just bend the curve and flatten it out, but now we need to get it. Obviously, I would like it to be zero for a number of days. That is the aim, the goal, and ideally zero for many weeks. But I do recognize that we have a little bit of room to play. Play's probably not the right room. We have a little bit of room to ease within that if we are able to do it safely. So things like making sure that businesses that open have the appropriate precautions in place, that we maintain our social distancing, our physical distancing from each other, that we don't start increasing our connections very dramatically, because we know that that's where this virus can take off. So having gatherings with lots of people, getting together with many different people outside our circles that we have put together for ourselves in the last few weeks is where we're going to see this virus catch fire and be able to take off again. So we need to gradually open things up, but keep those restrictions and be able to find people really quickly before it turns into a rapidly increasing outbreak. We're not there yet, as we can see by the fact that we're still having quite large outbreaks that we're discovering too late. So those are examples to us of how we need to do better to find people who are ill, to recognize it in ourselves, and to stay away from others and break those chains of transmission before we get those large clusters that can very quickly, as we've seen in many other places around the world, and more recently in places that had it fairly under control like Singapore, it can rapidly explode again. So we need to be vigilant, all of us, about that, and each of us doing our part about maintaining those physical distancing, washing our hands regularly, and critically important, recognizing and staying home if we're ill, and then connecting with us so we can get testing. So that's kind of a long way. Zero is the ideal, but we can manage as long as we're all doing our part